progressive supranuclear palsy for medical students. It is a neurodegenerative disorder that primarily affects the movement and can be challenging to diagnose due to its similarity to other neurodegenerative conditions. It is rare, estimated to be around 6 in 100,000, and it usually occurs in the individuals aged 60 or older. The clinical presentation for the motor symptom is characterized by progressive loss of voluntary control of movements. The patient often present with the upright posture, stiff movements, and difficulties with balance that leads to falls. Abnormal eye movements, especially the difficulty looking downward, is the key feature. Cognitive impairment may occur in later stages, but it is primarily a movement disorder. Distinguishing it from the other neurodegenerative disorders such as Parkinson disease is crucial, which we're going to look later in the video. The vertical gaze palsy, that is difficulty in moving the eyes vertically, particularly downward gaze, is a hallmark sign. Dysarthria or the dysphagia, that means speech and swallowing difficulties, can develop. It involves accumulation of abnormal tau protein in the brain, leading to cell damage. The basal ganglia and brainstem are primarily affected, contributing to motor and oculomotor dysfunction. Clinical diagnosis is based on characteristic symptoms. Neuroimaging such as MRI may show brain atrophy. Also, the typical sign which we call it as hummingbird sign, but it is not definitive. The supranuclear palsy can be mistaken for other Parkinsonian symptoms like Parkinson's disease, corticobasal degeneration, or multiple system atrophy. The symptomatic and supportive care, as there is no cure, the management is always the supportive and symptomatic. Physical therapy can help with mobility and balance. Speech and swallowing therapy may be necessary. Talking about the prognosis, progressive deterioration occurs and life expectancy is typically reduced. The rate of progression may vary among individuals. Distinguishing between progressive supranuclear palsy and Parkinson's disease is crucial in clinical practice. In supranuclear palsy, it is more rapid onset and faster progression compared to Parkinson's disease. In Parkinson's disease, it is usually slower onset and progression. The primary symptoms in supranuclear palsy is the prominent vertical gaze palsy, difficulty looking downwards, which is a key point for supranuclear palsy. Early and prominent postural instability leading to backward fall. The backward fall is a key feature here. In Parkinson's disease, the key features are tremor at rest, commonly resting pin rolling tremor, bradykinesia, that is slowness of movement, and rigidity are pronounced. Talking about the eye movement abnormalities in supranuclear palsy, it is vertical gaze palsy and affecting both up and down eye movement. Parkinson disease, eye movement are generally spared. Vertical gaze palsy is not a characteristic feature. In supranuclear palsy, the patient often exhibit characteristic axial rigidity with stiffness, upright posture, difficulty maintaining balance. And in Parkinson's disease, posture may be flexed forward and patient tend to experience shuffling gait with small steps. Response to levodopa. It is less responsive to levodopa when we talk about supranuclear palsy, and a positive response to levodopa with improvement of motor symptoms in Parkinson's disease. The tremors are less common in progressive supranuclear palsy. whereas the resting tremor is a common early symptom for Parkinson disease. Talking about the neuroimaging findings, the progressive supranuclear palsy is it is characterized by mid-brain atrophy, also referred to as hummingbird sign. And if we talk about the Parkinson disease, imaging may show changes in the substantia nigra, but midbrain atrophy is not a typical feature. Cognitive impairment, including executive dysfunction, and can occur, but it is not a primary feature in progressive supranuclear palsy. The cognitive decline, which is often present, occurs later in the disease, also occurs later in the disease course, is a common feature in Parkinson disease. The other features like speech and swallowing difficulties are common in progressive supranuclear palsy, whereas it occurs very late in the disease if we talk about the Parkinson's. Understanding these clinical differences can aid in accurate diagnosis and management of these movement disorders. Always consider the patient's complete clinical picture, conduct a thorough neurological examination, and use diagnostic criteria to guide your evaluation. Thank you.